The emergency department sees any child from the age of 28 days, sometimes younger, right up to the age of 18. The emergency room has access to specialties that other institutions do not. We are open 24/7. We see every patient that comes through the door when they ask for help. The sicker a patient is, the less the wait time is, and that's just the reality of emergency medicine.
I was cutting a bagel because I was in a rush to somewhere, and I cut my hand.
Right. Probably grab Dr. Porter or Dr. Don't be afraid. Okay, I promise.
Basically, we're here for every child in the province. We get patients referred in from as far away as St. Anthony, St. Pierre. We get them from everywhere. So we're here to serve any population, any area of the province.
Triage is a process that we do here that all emergency departments do, that we use to figure out who's the sickest. So we say anybody who presents to the emergency department is considered sick. So then we kind of got to figure out if they're sick, sicker, or sickest.
We try, to limit waits as much as possible, but, sometimes there's more acute things happening. Sometimes it looks like it's really not much going on when kind of inside the department, everyone is pretty busy with maybe 1 or 2 sick children.
Janeway Emerge is trying to address some of the wait times. And we're doing that by adding services within the emergency room which would help pave the way for our patients. One of those is the addition of a physician, so we have double coverage within the emergency room, and it covers our busiest time of day.
So today, my son had an allergic reaction, so out of caution and nervousness, we thought we'd come in and make sure everything was fine.
You don't feel like you're scratching there, hey?
No.
And your eyes, is the swelling okay now? It's about the same?
I think so.
For me, the toughest part is accidents, like things that through no fault of their own, they are here and in pain. So that's probably the hardest part.
Communicating with the parents of the patients it's a difficult thing sometimes. It's very difficult, when it's a code or major trauma where there's probably going to be a tragic outcome. So that's very difficult to deal with. It never gets easy. Even after 30 years, it never gets easy to do. And for the simple stuff, I just talk to the parents as if they're one of my friends, and just talk to them one-on-one and tell them what we're going to do with their child. When it comes to families of the patients that we have, if there's been a poor outcome, we would direct them to the appropriate service. And that could be anywhere from a private psychologist to our psychology department here, to a bereavement team, pastoral care. There's a long list of different services that we would avail of.
We're actually seeing a rising number in mental health presentations right now. A lot of people aren't aware that we provide these services and support for mental health here in the Janeway Emerge. If anyone is experiencing a crisis or a safety concern, we urge you to come for assessment and support.
So this is the x-ray of the little boy that we just saw. So he's just a soft tissue injury, basically, one on top of the other. So I'm going to go in and explain that to him now. Yeah. And I think it's just the fact that he had one injury, and that wasn't going to get better, and he had a second injury.
All in the same day.
So I would do what he can to rest this.
We see children, when they shouldn't be at their best, I guess. They're sick, they have an injury, they have some kind of illness, but they're, amazingly positive about their experiences, even when they're going through trouble like that. They have a positive attitude almost all the time, even when they're going through difficult times. So I would say that inspires me about children.